Welcome to this episode of the Drive to Explant. Am I going to wake up after surgery and basically pass under anesthesia, which is, I think it's a question that certainly has been brought about by how many documentaries and things have been done about patients, quote unquote, being awake during surgery. There is an instance where that could happen, but it's more of a error in terms of medication. It's not a function of the anesthesia providers not trying to take care of the patients or not providing enough sedation. So in general, when we're speaking about our group that we work with that has done thousands of my explant cases, we have a specific protocol to help reduce pain, keep everybody very comfortable. And when you're waking up, the wake up is not really a long wake up, meaning you don't stay in recovery a really long time, which is important because everybody's, your loved ones, your family members, everybody's kind of like worried and concerned. They want to know what's going on. So we try to get you back visiting with your family as soon as it's practical. So all of this and all of my work regarding my SHARP methodology and the programming and everything that we do, supplementation, diet changes, sleep modifications, it's all meant to make the actual, day in and out of the surgery center as smooth as possible. So let's break it down. When people, engage with us, I have everybody start a supplement program. And I know everybody's, maybe got their faves, or they like to dabble a little bit in supplementation because they saw something on Instagram or they saw something that looked appealing or their friend told them to start something. So I get all that. I just don't care. So basically, we've done hundreds of genetic analyses on our patients, and we know where they need to have support. And that support, it's critical that it actually, from a nutrient standpoint, you get the nutrients. So we don't give people a ton of capsules. Initially, when I started, I was more the mindset, hey, we got to supplement all these things, but now we don't supplement that way. We try to really focus on what is the most important and use those avenues to help get your immune system working better and better and better. And we do that with liquid-based supplements. So we have liquid-based supplements predominantly in the inflammation support bundle, which you can head over and look at. And if you're in the United States, you can get all of the liquid-based supplements. So those start lowering inflammation. You modify your diet to reduce inflammation by reducing gluten, dairy, and cut out all processed sugar. That will help you reduce inflammation as well. We're going to look at everybody's gut health, food sensitivities, hormone balance, metabolomics. We're going to really, try to be as comprehensive with the available testing that we have. That's functional genomic and functional medicine and toxicity testing. We look at toxicity, try to get a handle on everybody's tox burden. And so everybody gets exposed to different things. A lot of patients in the past week actually have told me how they don't have any symptoms or any problems. And I talk to them for a little bit, and there'll always be something like their thyroid is off, or they may have a little bit more anxiety or a little bit more fatigue. And it's been written off to be perimenopausal or having children or getting older. Just all sorts of more excuses, really. So once all of this has been started and is processing, labs are being resulted, a plan is formulated for detox. So we have a supplementation program, we are developing a detox program, and we're going to create a specific individualized surgical plan for you. So that may vary. Obviously, the baseline thing that everybody's coming to me for from around the world is to get an explant. I do the capsulectomy. I'm trying to always get all the material out all the time because I had patients with breast implant associated cancers. I've had patients with breast cancers, and we don't want to obviously leave any cancer residual materials. If someone had a recurrence, that would be just inappropriate on so many levels. My sister died from breast cancer this year, and I'd be really upset if someone wasn't taking care of her properly. So when we develop your surgical plan, get an Explant. If you want to do a skin lift, we can do a skin lift. To change nipple position, a vertical lift is the best option. It doesn't affect the bottom of the breast in a way that's unnatural, like an anchor lift will. We can do periareolar lifts and take out implants that way through that small incision, and that's good in some instances, but does not change nipple position. And then a lot of people want to have me do a fat transfer at the same time. We do provide that service. I also do skin tightening at the same time. So we have multiple things happening at the same time in terms of supplementation, surgical planning, detox planning, modifications in diet, modifications in sleep. The sleep part is very important. You've got to get sleep 6.5 to 8. It's kind of minimum. And the quality and depth is important. So all these things, once again, they're all in process. And this is all leading up to the day of surgery. And as I drive to the surgery center, you know, these things have already been happening for all the patients I'm going to take care of today in Austin. So before surgery, I always will mark someone. The only time we won't is if we're just taking out an implant through an existing incision under the breast that's already there, and we don't obviously need to mark it. But any lift procedure or where we're gonna remove fat from, we would mark. Then anesthesia will get you prepared with a nerve block. One of the nerve blocks they like to do is the serratus anterior, which is on the side of the chest, and that really helps give nice wraparound anesthesia. Also, if we're gonna do more work, especially in the position where you're on your tummy in the operating room, they're going to add additional medication around the rib cage, and that will help even anesthetize those areas further. So the whole chest really gets treated before I've ever done anything. And then typically anywhere I work, I use a long-acting liposomal bupivacaine. Lasts about 7 days. So that's a local anesthetic, lasts about 7 days. It sits in the tissues. And then we do all the work. We do the Explant, we do the fat transfer, we do the skin lift, skin tightening, whatever combination we've decided to do as the surgical plan, we get all that done. I do additional, placement of medication, like I said, as well as when I'm doing an Explant, I'm looking all along the tissues where I operated, and I put in the pain medicine directly looking at the area. So we do a lot to try to really diminish any kind of sensitivity that's going to be too sharp or cause too much discomfort right away. And then we get you wrapped up. I usually use ice packs gently if we're not doing a fat transfer, because I don't like squishing around ice packs on the fat. So every explant lift, I wrap up, we put ice packs on. We do a video for everybody. We take still photos. I try to make sure I comment on everything because everybody's pretty interested in what I found in real time. So I try to do that for you every single time. And then we let you get out to recovery, and once you've had a little bit of time to wake up, usually my folks are giving you the gluten-free snacks and the coconut water, and then we'll get your family back with you. But really, we want everybody to have a really smooth, calm experience. So one of the things that really diminishes pain is we don't use any drain tubes. So there's no drain tubes. We don't use any additional antibiotic therapy. So you're not taking oral antibiotics after surgery. We do have you on medication that starts the night before to control pain, swelling, nausea, and then we carry that out as long as we need to after surgery. We have enough for the first couple of weeks, depending on how everybody's needs develop. All right. Y'all have to like the video, subscribe, hit us up if you're interested in learning more. Go to drrobsolutions.com if you're looking at the supplements. And my book, Sharp, will be out. You can pre-order it on my website or through my store, Dr. Rob Solutions.